discussion on whole child and adolescent health during COVID-19. I'm Kathy Higgins, CEO of the Alliance for a Healthier Generation. And a healthier generation, we are a systems thinking, systems change mindset and approach to our work. We're committed to transforming the environments where our children live, learn, and play to create a healthier and equitable future for every child. We're honored to co-host today's conversation with Unity Consortium, and we're excited to be joined by Dr. Chelsea Clinton and our panel of whole child health and adolescent experts. Today, we'll be discussing the widespread impact of COVID-19 is having on critical child and adolescent health issues, including nutrition, physical activity, social emotional health, and vaccination. And we'll explore ways schools, healthcare providers, and families can work together to combat these challenges to support student well-being during these challenging times and beyond. Before we dive in, I'd like to welcome Judy Klein, the president of Unity.
Thanks, Kathy. And as president of Unity Consortium, I am thrilled to co-host this important panel discussion. Unity members are passionate about adolescents and young adult health and setting them up for lifelong health. We do this by leading, innovating, and educating to ensure that they get the vaccines and the preventive health care they need to stay healthy throughout their life. During the pandemic, adolescent vaccination has plummeted by more than 80% at times. And though that crept up a bit this summer, adolescent vaccination remains well below last year. Unless they catch up, many children will be left vulnerable to illnesses like meningitis, whooping cough, and cervical cancer. Historically, schools have been a linchpin in ensuring our adolescents get the vaccines that are available now to protect them against these devastating illnesses. So we believe it is imperative to prioritize, Kathy, as you just said, whole child health during this time, including adolescent mental and emotional well-being, which we have heard from our teen advisors continues to be an issue, and prioritizing protection against preventable illnesses by vaccinating. I look forward to hearing from our panelists on how schools, healthcare providers, and families can work together to achieve these goals throughout the pandemic. And now it's my honor to welcome today's moderator, Dr. Chelsea Clinton, Vice Chair of the Clinton Foundation. Thank you.
Thank you, Judy, so much for that warm introduction and for helping to set the stage for our conversation today. I'm really looking forward to listening to and learning from all of our panelists as we talk about vaccinations and so much else. So before we begin, I'd like to welcome our panelists, who I'm hoping will kind of magically appear on the screen with me here today. I'd like to welcome Robert Boyd, the president of the School-Based Health Alliance, Pia Valenzuela Escudero, the executive director, Division of Student Health and Human Services at the LA Unified School District, Holly Hunt, the chief of the School Health Branch Division of Population Health, National Center for Chronic Disease Prevention and Health Promotion. And finally, but certainly not least, Dr. Charles Irwin, the Director, Division of Adolescent and Young Adult Medicine at UCSF's Benioff Children's Hospital. So I can't see them, but hopefully you can see them, and hopefully I will be able to hear them, and hopefully they'll be able to hear me. And I want to start our conversation really as a segue from what Judy just mentioned. How many children are missing well child visits and now missing needed immunizations? Certainly as a parent, I know it can be worrying to take our kids to the pediatrician's office these days, but all three of our children are kind of fully up to date on their vaccine schedules, including, for the flu vaccine. And so, Dr. Irwin, I just would really appreciate if maybe you could start us by just reflecting on how this is impacting students' kind of overall well-being and kind of what else you're worried about, along with what Judy said, and how can we try to reverse this trend? So kind of what are you worried about, and how can we try to help parents understand they need to be prioritizing their kids' vaccine schedule.
Well, thank you, Chelsea, and thank you, Judy. I first of all want to say that the healthcare systems have really adapted over the past several months, and our clinics are really safe for parents to bring their children in and for adolescents to come in. But it appears that even in our own clinical system here at UCSF, our parents are frightened. They don't want to bring their adolescent in. Their adolescent is afraid they're going to catch something if they come into our clinic. So we've developed all kinds of mechanisms through hybrid care. So we do a little video chat, and then we bring them in after we do a video chat. So there are many ways in which the system here has responded. And well care is really, I think, the center for child health. Adolescents don't come in very often, so that annual visit for general checkup is really essential for vaccine delivery, for making certain of their growth and development is proceeding as we would hope it would be. And I would say that what's happened right now is adolescents are so socially isolated. They're not in schools full time. They weren't able to do anything this summer. They're kind of in total lockdown. And being locked down during adolescence is inconsistent with the developmental needs of teenagers. Teenagers need to be socially interacting with others. And we've locked them in their rooms. And so one of the things that we feel is essential in this general checkup when they come in, we want to check on their nutrition. Are they overeating? Are they undereating? How are they doing in terms of their mental and physical well-being? Suicide rates are astronomically high now in adolescence and young adulthood. They're higher than they've ever been. So if we can see a young person in our clinic earlier to really identify if a young person is depressed, is sad, then we can intervene with a mental health care provider, social worker, et cetera, to really assist them. So.
Just Dr. Irwin, kind of pushing a little bit about, what you said, which certainly has been, my experience here in New York, that, our clinics, our hospitals, have really worked to be robustly safe. What more do you think we can be doing to help parents really understand that and to help kids and adolescents understand that? What are the public messages that we should be sharing and amplifying?
Well, an adolescent recently told me that we needed to develop a video and that we needed to actually show young people through YouTube what it's like a day as you walk through a clinic. And because he said all these messages that we give them aren't sinking in, and perhaps we need to do more of that, more social media, because it doesn't seem that we're really making much way with telling parents and young people they need to come in. And we especially want them to be coming in because we want to be ready for the COVID vaccines when it comes out. And if they're afraid now to come in for the routine vaccines, then we're even going to be in more trouble when these COVID vaccines are released.
I share your concerns, and we'll try to think about who I know who can maybe be helpful in making videos or supporting young people in making videos to talk about the importance of vaccinations, even and arguably especially now. Dr. Warren, if young people aren't coming to see you, they're also often, as you mentioned, like not in school, so they're not seeing their school-based kind of healthcare providers either. So I'd like to turn to Robert Boyd and to just ask you, Robert, how has the pandemic impacted school-based healthcare, school-based health centers? Kind of, if students aren't coming to school, how are you working to still support kind of your students' health? And what do you think this audience should really know about how school-based health centers have pivoted during the pandemic?
Thanks, Chelsea. And to piggyback on Dr. Irwin's point and yours, you are blessed to have a pediatrician for your children and the means to be able to take them to the pediatrician. School-based health centers serve communities of color and communities of that are serving low income. They're serving low income households. When school buildings got shut down, many of the school-based health centers got shut down too. As a result, our people pivoted to technology. A lot of that was a function of the ability to do behavioral health over the phone, over a video chat. But as was said, vaccinations haven't happened, well child visits haven't happened, and it's largely our ability to function within the school. We're a full service health clinic in a school serving kids from low income families. They're simply not getting access to the students as they would like, and the students aren't getting access to the care. It's been traumatic. We don't know how many low income students are not being in communication with their schools. Baltimore says as many as a third of their students they haven't heard from. Our people are very resilient. Our workers, our clinicians are very resilient and very creative. We've heard about nurse practitioners taking their equipment and going to the parking lot and encouraging kids to come through. We've heard of school-based health centers that even though the school building closed down, they refused to close down. I can't tell you about where they were because I don't want to get them in trouble, but they just said, no, we're it for our kids. If we are not available to them, there's no place else for them to go. And I think that's the reality in the low income communities, that school-based health centers are the main clinic that most of those students go to for their services.
And Robert, how do you think about, still in this moment of being, separate and apart, and clearly, recognizing all the work that may be happening off the grid in parking lots, and the vital work of continuing to see students, through formats and maybe for like this. How do you think about the kind of specific question that, Dr. Irwin was reflecting on, the question of vaccination, so that, you are able to answer whatever questions, parents and maybe students themselves have about kind of vaccines broadly, or about an eventual COVID vaccine? How do you think about that? Because, as Dr. Irwin mentioned, I think he and I and so many others are very concerned that, huge swaths of our country say they won't take a COVID vaccine, including, for understandably, historical reasons rooted in trauma and exploitation, many communities of color in our country. So how do you think about, kind of, given you have such a trusted role with your students and their families, kind of engaging in work to help really educate people about kind of what this is, what it isn't, and why it will be so important that they and their kids get vaccinated?
Yeah, we're worried about cluster outbreaks all over the country because students are not getting routine vaccines. So the issue of addressing COVID is one issue over here. We're worried about the routine stuff as well. I like Dr. Irwin's idea of doing videos and putting them out on YouTube. Dr. Angela Diaz at the Mount Sinai clinics in New York has floated the idea of maybe we need to be utilizing our adolescents as ambassadors to go out to the communities and say, hey, you can trust these folks. We trust them. We work with them all the time. Come on in and utilize the services. But again, that assumes, in our case anyway, that the physical location is available for those students. School-based health centers stepped up during H1N1. We've stepped up. We've helped maintain the high vaccination rates in the schools we serve. But another part of the problem is there's not enough of us. There's only 3,000 school-based health centers to serve 47,000 Title I eligible schools. 24,000 fully Title I schools in the country. So we need more of us. Technology can help bridge that gap, but we don't have enough healthcare workers to work in schools as it is. We don't have enough school nurses. We don't have enough school psychologists, and we're just focusing here and now on the physical. Hopefully at some point we'll also talk about the pending mental health crisis in schools. Our schools are going to reopen in trauma. And we need to recognize that. And we are simply not ready to address that. We have done nothing.
I definitely want to come back and talk to you about that, Robert, but I do want to ask Pia, so we'll stay kind of in the school space, just to share a little bit about kind of, I think, the really tremendous work that LA Unified has done to continue to support students, not only kind of as learners, but as whole children. And so, Pia, maybe you could just share kind of what you have been doing to ensure that hopefully most kids are engaged and connected and learning, but you're also helping support their physical and emotional needs as well.
Thank you for this tremendous opportunity to learn from one another and also highlight the importance of our schools being the nexus to so many communities. Never before have we really seen this come alive as we did when COVID struck our communities, and we had this urge to feed our families. We established grab and go centers where we not only fed children, but their families, and then we opened it up to communities. And so that concept of a school district becoming the main force feeding communities has become very apparent in Los Angeles with the work of LAUSD. And I have to tell you, it wasn't like we had the staff. It was our after school workers. It was volunteers and folks coming out of their homes during a very scary time, which we seem to be experiencing again right now. This concept of vaccination has been huge for us because as we start planning for hybrid, we realize kindergartners and middle schoolers are not vaccinated. I want to highlight that what has worked is that we have staff on the phone calling families, and we can't just talk about vaccinations. They need basic needs, sharing information. We've had needs for all kinds of basics, diapers and baby wipes. So we've had a huge surge of services that are telephonic. Our staff had to learn with a partnership with Amazon Connect how to hold a hotline via their laptop and find a place from home to work and help families that are very much in need. There's so much I can share with you, the heroic efforts. What I want to highlight is that we actually just opened by volunteers 2 immunization clinics in very stricken neighborhoods with volunteer pediatricians and school nurses. And we've actually learned Children's Hospital of Los Angeles launched a drive-through immunization clinic. And so we took their model, working very closely with partners in our city, and how to come out from our clinic and as families are driving by and give vaccinations. And it's going to take a heroic effort to vaccinate. And I think that when we're talking about a COVID vaccine, we'll be very creative. But it's not just, I believe, hiring staff. We need the funding. We're encroaching on the educational dollars that should be in the classroom to provide whole child services that are so basic right now. And so we can talk about the mental health issue as well, but the whole concept of this collateral damage that COVID has exacerbated and the equity gap of our students, and the fact that children in our country are so hungry and they need so much. And we have this opportunity to create systems of whole child support so they can learn. I hear this whole conversation about our children going to be behind academically and they're not learning. Well, let's take baby steps to what is really essential to make sure that they're whole, healthy, and well so that they can learn. So this discussion is so important, and we can continue talking about it, but I think the secret sauce is the human potential and the funding to fund these services that can be done in very creative ways when we have the resources. I want to say that I know that our district is doing a tremendous job, but we're not sure how we're going to fund this, right? The funding to feed everybody, I know our superintendent is doing heroic efforts to get that funding, and then also to bring the cadres of professionals that need to address the needs is tremendous.
Pia, thank you for sharing all of that, and I couldn't agree more that we need desperately more resources, financial resources, but also, to Robert's point, human resources. And I do now want to ask Helen to just reflect on kind of what she really believes are kind of the most important roles of schools right now in this moment of trauma and then moving out of it. And what does she think the messages are that schools across the country should be delivering to students and families to support the whole child, and also kind of anything, Helen, you might reflect on as relates to the conversation around immunizations.
All right. Thank you, Chelsea. And I just want to point out, as my esteemed co-panelists have indicated, aside from a child's home, no other setting really has more influence on a child's health and well-being than a school, whether it's information regarding well visits, preventive care, safety of vaccines, working with local health officials to provide the latest information around COVID, and working with communities as a whole to help prevent the spread. So the schools play such a critical role in terms of the messaging related to all the issues we've been talking about so far this morning. And some of those messages, have to do with connecting families to essential health services and support, even though, we're in a virtual learning setting. A lot of schools are using very creative ways to do that and using a variety of techniques for communicating. And I want to speak to something Pia referred to in terms of getting meals for children. An important role for schools to play now is sharing the fact that USDA has extended school meals to all children free of charge through the end of the school year, which is huge and really addresses some of those concerns around food insecurities in certain communities around the country. Some other important roles, I think, in terms of messaging that schools can play is encouraging students, employees, families to take a break from watching the news, whether it's watching, listening, social media, that can be really overwhelming. And as always, we want to encourage everyone to get adequate sleep, healthy eating, physical activity, all those things that, help provide nurturing to our soul and well-being. So that's important for students as well as families. And I know we're going to probably get more into this discussion, but schools play such a critical role in helping provide access to students for mental health services. And there's no greater time than now that is just so very critical. And, we work here at CDC within the framework of a whole school, whole community, whole child approach. And that's really engaging everyone. And that all things, all components in a school environment play into a child's mental health and well-being. And as Robert said earlier, we have a lot of work to do to address the mental health and trauma that is currently happening with not only our young people, but our families and staff in schools.
Thank you so much, Holly. I do now want to talk about mental health, and also just want to invite the participants to submit questions for our panelists. But I think maybe Dr. Irwin will go back to you, especially since you mentioned the deeply worrying and horrifying and deep sadness kind of embedded in what you shared as rising kind of death by suicide incidences and rates in our country for adolescents and young people, and also kind of rising suicide ideation. So maybe Dr. Irwin, you can just talk about kind of what you are doing in your practice to try to help support young people who are struggling with a variety of mental health challenges, and what do you want this audience to know about kind of what more you think we all could be doing, whether as citizens, parents, providers, or all of the above? Did we lose Dr. Irwin? I can't see anyone, admittedly, so I'm not terribly good.
Sorry, now I was muted, so now I'm not muted. Sorry about that. I think the good news about telemedicine, telehealth, video outreach, we are able actually to connect our young people with a number of different groups of adolescents that are working with a therapist or social worker to help them through these areas. And they don't have to literally come into a setting. They can do it through what like we're doing right now. And this has really opened the door, in particular in the state of California, where we have large numbers of individuals who live in rural areas that don't have access to coming into clinical systems of care, but can open their doors through video. I also think that what we've begun to do a lot of that, we can't assume that there will ever be enough mental health practitioners to care for children and young people and adults with mental health or behavioral health issues. So we are increasingly training our physicians, nurses, other health professionals in the university to really be able to work with children and adolescents who have behavioral health issues, and that they can do what I would call kind of primary and secondary interventions for young people, and not necessarily referring them further to a mental health professional. And oftentimes young people feel better in some ways talking to someone that's not labeled as a mental health professional. They're labeled as a person who's assisting them moving forward. I think schools, as Robert has mentioned, and Holly has mentioned, and Pia has mentioned, all schools are really, really important also in terms of helping young people. And a number of our medical students and nursing students have been volunteering and going in to work with schools to provide support services for systems that have not been able to generate those resources themselves. It's a huge problem. I think all of us need to work together to operational new ways to reach young people and families that we may have not used before.
And Robert, maybe just, a similar set of questions to you of kind of what are schools doing now that maybe, weren't happening, like when I was a kid at, I don't know, Booker Elementary in Little Rock, Arkansas. So just kind of for those of us that, now have school age or are young kids, just to be aware of like what schools are doing now that is different than may have happened, a generation or two ago. And what more do you think schools could be doing if you had the resources?
Yeah, two good questions there, Chelsea. Tech is going to matter, but tech is not a replacement for in-person care. It's just another tool in the doctor's black bag or in the psychologist's tool chest. There are some exciting online platforms like Just Health that are out there that enable the students to be able to communicate their issues to a provider without feeling that pressure of having to answer those intimate questions face to face. But again, nothing is going to ever replace in-person care. Students seem to have gravitated to the online platforms a lot more than many of our providers have, because you keep us old folks around for advice and experience, but we need the young folks to show us how to use the technology. So tech is going to matter, but you got to ultimately come back to the comment that Pia made about funding. We put a lot of pressure on our schools. The purpose of our schools originally was to educate our kids. Now we expect them to feed, we expect them to take care of their mental health, we expect them to take care of their physical health, yet we don't provide the commitment to fund those activities. My prayer coming through COVID is that we will have a new appreciation for the role of educators in our society, the role of healthcare professionals in our society. If we had half a brain, we'd be looking at the last 6 months and we'd realize you are not going to fully reopen this economy until you reopen our schools. And it would move our educators and those who work in school environments higher up on the priority list of those that ought to be getting vaccines first. We have to focus on getting our schools reopened and stop just focusing on bars and restaurants. But that means we also have to focus on their behavioral health. We have to focus on it. I came over from the school safety movement, and I've seen schools in trauma. Parkland, Colorado STEM, Santa Fe. I've seen these schools, and I'm telling you, I'm not a alarmist, but we are going to have 100,000 K-12 public schools that, when they do fully reopen, are going to reopen in traumatized environment because COVID doesn't care about your economic standing. Your kids, other kids of means, are going to have the ability to go get help. But in our schools, our Title I schools, serving kids from low-income communities, the only potential help they've got is coming through the schools. Yet, as Pia points out, nobody's given us the funding to be able to meet those needs. And I'm not even talking about the anticipated needs. I'm talking about the needs we already know about. So funding is a huge issue that we have to address. We have to make a commitment in our kids, otherwise, and stop just expecting our schools. The schools can do it. They need the resources to do it because, yeah, they can. They're very creative, but they have to.
Yeah, amen. Pia, if there's anything that you want to add from a kind of LA perspective, from kind of what you're doing, or sort of what you kind of specifically need to be able to support. I think Robert's absolutely right. Like, all the children who are living through the trauma of COVID, and for so many who are living through the trauma of COVID, it is only an additive and kind of compressive trauma on top of other traumas in their lives. So maybe just, if you could talk a little bit about kind of your perspective in LA and from the school district's perspective.
As I take a deep breath, and I just tell you, I'm very passionate about this. I've been doing trauma work for 20 years in the United States. And when we started this work, we realized that trauma was more prevalent than we could even imagine. And in a partnership we had with UCLA and RAND, when we started screening children in Los Angeles for trauma, they told us to do it again, that the numbers were too high. And what we learned is that our numbers for exposure to trauma are higher than military and service soldiers. And so what we've learned is that children are exposed to trauma by 6th grade at enormous rates, and by 9th grade it's prevalent. So I want to tell you a stark picture. Our children were not well before COVID. There was a prevalence of trauma, a prevalence of depression, anxiety, and suicidal rates that is just now being documented. And I have had a chance to learn a little bit about Los Angeles and some of the studies that say that in the past 10 years, we had a 104% increase in inpatient visits for suicide ideation and self-injury for children 1 through 17, and 151% increase in children 10 to 14. And we had a 50% increase in mental health hospital days. So we're paying for psychiatric care. And then when we self-report children, 61% said that they reported mental health needs. This is before COVID. And now during COVID, I must say that for all of us here and many of our children, a low-grade depression and anxiety are norm. And then we get spiked by everything, as was mentioned. We watch the news, and then our tolerance window is just off the chart. So before COVID, the second leading incident that disrupted our schools in LA, and that's because we have teams that report and we've trained, was suicidal behavior, injurious behavior, and hospitalizations. We even had a mental health evaluation team with social workers, and we're doing some very progressive things here in LA, and school police. They would come out to schools to assess children and create safety plans so we wouldn't hospitalize. We had 1,700 calls last year. And that was, the calls diminished. That's my concern. They diminished because we're not seeing children, and we don't have eyes on children, and they're not able to tell us how they're feeling. We're providing that without a doubt. Telehealth has given us some great tools. We're providing services. We're engaging parents with telehealth, but in no way are we prepared to address what we need to address in the school. And I go back to the instructional and the measurement of our children's outcomes academically is going to be low, but it's also important to look at the well-being and the mental health. What we're doing in LA is absolutely looking at ambassador programs where children's voice and their strengths are voiced in a way where children learn from each other what gets them going and how are they resilient. We're doing a tremendous launch of training people on trauma and resilience science. What does neurobiology and the epigenetics and ACEs and the science of resilience look like? Because we know that every adult on a campus is going to be able to be an antidote to the traumatic stressors and that. But again, the more adults we have informed and more access to those kids that need clinical help, we'll need to have that team. I want to share with you that one of the first issues that we had to deal with was like Zoom bombing and kids, giving the links to others and disrupting instruction. And then we had to face this concept of, do we suspend kids? Do we cut them off from the one lifeline they have to learning? And we said, no, this is an opportunity to build community. How do we do check-ins? And so we launched this phenomenal campaign, and we have 8,500 teachers in Schoology that are feeding us lesson plans and just messaging. Our Mondays are Mindful Mondays, Tuesdays are Gratitude Tuesdays, Wednesdays are Wednesday Wellness Wednesdays, and Thursdays are Thoughtful Thursdays, and Fun Fridays, so that let's focus on being us, being together. We matter and we all are part of a community. But it shifts away from the systems and the pillars that we had before COVID weren't working. And our children were telling us, this is not okay. We're not okay. If we're hospitalizing and we're dealing with children who need diagnosis. I mean, I have a lot to say because I think we're setting up a system that supports pathology, and it's really changing our pillars so that children get access to help without a diagnosis and get the funding that they need for therapy. Parents are hungry for parenting groups. We have, there was a parent group yesterday, the other time with 1,100 parents learning about trauma, learning how to address anxiety. So people are hungry for this. So the thought of having access to turn this tide around and enforcing healthy behaviors, it's an opportune time. And I think it requires a huge shift, but it requires the youth to tell us also what they need, and so that we don't go towards a psychiatric hospitalization and increase medical stays. There's not enough psychiatric beds right now. Last week I was helping a colleague, a professional, with her daughter, and we couldn't find an inpatient bed in Los Angeles. And I know that families without means have a tremendous time accessing care. So with that, I just want to tell you it's a tremendous opportunity to do better.
Well, I think we have to see this as a tremendous opportunity to do better, and then to do better. Holly, what is the CDC's role in this conversation, do you think? Is it about kind of helping to articulate kind of guidelines, or kind of really amplifying examples of what is working, like what Pia shared in LA? Like how can CDC try to really be a partner here to schools, teachers, pediatricians, parents around kind of this specific question of mental health?
Thanks for that question, Chelsea. And I just want to say how much I appreciate Pia's comments, and kudos to the great work that you all are doing in your district. It takes a village, right? So I'm reminded of how much work and support we have from not only our other federal partners, but our national organizations such as Healthier Generation. And what we do at CDC, of course, is provide the best evidence in the science to support the mitigation of COVID, but also within the area in education and supporting school health initiatives. We want to provide the resources, the tools, the professional development that will help states, local districts, and schools do their very best at addressing not just our, risk behaviors of young people, but the whole child, the mental health, the ensuring that young people feel supported and engaged. One of the things that we emphasize is the role of school connectedness. And ideally, before COVID ever came along, we would hope that, or we would encourage, I should say, that schools have teams made up of community members and parents that are fully engaged. They're engaging the community. They're thinking about what's best to create a healthy environment for their students as well as their staff. So mental health is one part of that, but it's overarching with everything that we do. And so we continue to learn from the field. We learn from our education partners who are dealing with this with their local districts and their schools. They are doing their best to integrate mental health and social emotional strategies into the work they do under our funding, which is not specific to mental health. But again, these are different times. And I do want to share, we do create at CDC a number of audience-specific resources and tools, and many of those have been developed for schools to be able to more effectively address COVID. But there was one that was recently developed that I wanted to bring to the conversation, and that is a COVID-19 parental resources kit. And that kit is specifically designed to help parents identify children and young people's social, emotional, and mental health challenges, and to point out some of the things they can do to ensure their well-being. And that seems pretty relevant to what we've been talking about here today.
Great. Thank you so much, Holly. I know we're almost out of time, and we just got a few questions, and I'm sorry we're not going to be able to get to all of them, but there was one that I want to at least have hopefully brief reflections on, which is a question really rooted in how we know that physical activity is really important to support mental health and to support overall wellness. And kind of in this moment when we're, telling people to stay at home, I know my daughter has been going to virtual PE. And I am so impressed with her virtual PE teacher who has her enthusiastically jumping up and down and spinning around and pretending she has a hula hoop on. And it's amazing to watch. And so, I'm so grateful that she has that. Can you just talk about how, not only through virtual PE, but just generally schools and also pediatricians are encouraging kids to stay moving in this time in safe ways, but to keep moving, and maybe just, 20 seconds, kind of, Robert, maybe we'll start with you and Pia, Charles.
Yeah, I think I'm going to toss it to Pia because most of what we're trying to do is address the overall healthcare services in the schools, and while we encourage the physical activity and physical health, that's really going to be more of a direction from school folks. So I'll toss my time to Pia.
So Pia, and then maybe also Charles, you can talk about how you're trying to help the kids that you're seeing in clinic keep moving too. So a school and a doctor perspective, and then we'll wrap up. So Pia, please. Pia, I think you're on mute. Oh, maybe. Oh, Pia, we can't hear you. All right, maybe Dr. Irwin, maybe you could talk about how you're still encouraging kids to stay moving.
Yes. So we've connected at UCSF with the YMCA's in our community, and actually they now come to campus. And while kids are in hospital, they're actually working even with children in hospital. They're also working in the kind of social, we have certain space at the university where the kids go out and wait outside rather than inside. And they're actually encouraging the kids to move around and jump up and down and do whatever they can to encourage them. I think increasingly we just need to think about breaking down boundaries that really have limited much of what we can do. And I think COVID has actually provided that opportunity to think differently. And And like you said about your daughter with the technology, I think technology can really be helpful because kids can do stuff at home, watching a video about exercise and so forth and so on. So thank you so much.
Yeah, thank you. And that also highlights something else, that we clearly need funding for, to ensure that every child has a device that actually can be connected to high-speed internet so that children can be thriving, learning, moving, and hopefully healthy and well in this time. I just really want to thank all of our panelists. Pia, Robert, Holly, Charles, thank you so much for being with us today and for sharing your expertise. And I want to hand it back to Kathy and Judy to conclude our time together. And just want to wish everyone a very healthy, safe, and socially distant Thanksgiving.
Well, Chelsea, thank you so much. And certainly thank you as well to our esteemed and caring panelists. You're amazing. And thank you to all our participants. This was a fantastic conversation, and I can't wait to go back and watch it again and learn even more. Just to share, we will be sharing the recording for today's event via email next week. And in the meantime, you can find more information to these questions that have been asked and answered on whole child health and adolescent health and physical activity, and at healthiergeneration.org and unityforteenvax.org. So that's VAX.org. So we thank everybody and have a wonderful day.
Thanks so much. It's been a great conversation. Chelsea, thanks for hosting. Thanks to everybody. And a quick call out to my son, Mr. Klein, teaching 6th grade science, Success Academy in New York City.
Bye-bye.
Bye, everyone.